In our next session, Dr. John Martin, Chief Medical Officer at Butterfly Network, will be joined by Adam Willmann, Chief Executive Officer and President at Goodall-Witcher Hospital in Clifton, Texas, to discuss how utilizing information supports timely clinical decision-making and creates workflow improvements, helping clinicians achieve better outcomes and the hospital of the future. I'd like to thank the sponsor of this session, Butterfly Network. Butterfly Network is transforming point-of-care ultrasound with a groundbreaking solution and the world's only single-probe, whole-body handheld device powered by ultrasound on-chip technology. Butterfly transforms complex processes into one connected, focused system to help you offer better, more efficient care. Please welcome Dr. John Martin, Chief Medical Officer, Butterfly Network, to kick off the next session.
Thank you very much. Well, welcome, Adam. It's really good to meet you. I think this is going to be an exciting endeavor, and I think we should start this with you have a very compelling story on how you ended up sitting in the chair you're sitting in today. So I think it might be good to start with this because it'll lead into some very interesting questions that I have to follow.
Well, yes, I'm blessed and privileged to actually be the CEO of the hospital that I was born at. Our small town, Clifton, Texas, is located about 35 miles northwest of Waco. We're a county of 18,000. I was born and raised here. The current mayor of Clifton was the physician that delivered me. So I have some really deep ties. I kind of joke and said, my job, I started at Goodall-Witcher, 38 years ago when I was born. And so I've been here ever since. And it's been like I said, a pleasure and just amazing. It's more than just a job for me to come back and make sure that we provide high quality care because my parents still live here. My grandmother's a resident of our nursing home. So I have a lot riding on this. I tell everybody in orientation, make sure we do everything right, because if not, I'll hear about it at our family reunions.
Well, you may have been in the nursery the youngest intern for a CEO job on record, and maybe the longest running internship before you got into this chair. So how long have you actually been in this seat?
I actually started 9 years ago in October, so I've just celebrated 9 years. And prior to that, I served a few years as the CEO of a rural hospital in Blakely, Georgia. And then prior to that, I worked for a health system, a rural hospital in Athens, Texas, that was a part of the ETMC system out of East Texas Medical Center system out of Tyler, Texas.
So I'm going to ask you this question. It's an interesting one. And if you look over my shoulder, you'll see one of my favorite books on the planet, Start With Why. And I think it's such a critical part of the thinking of any kind of strategy or human behavior. But the thing, why healthcare for you? Because I think if we understand what drove you into healthcare, we might understand how you're thinking about, and maybe you might find some members in Clifton, Texas, say you're the hospital of the future and you're having that conversation in Clifton. It's really interesting to understand why we've come to you for this and what's driving you to make a hospital of the future.
My why I'm here, ultimately, I think it started, I wanted to go into healthcare. Of course, I wanted to be a physician or a vet, went to Texas A&M, found out very quickly that, studying was not my forte to become a physician. And so I was fortunate to kind of listen to a presentation on hospital administration. And one of my mentors kind of put it, Adam, as a physician, you take care of that patient that's in front of you. As a hospital administrator, you have the luxury of making sure you're providing care to every patient in your hospital or under your roof. And so that just kind of stuck with me. And I guess after kind of hearing that, I put all of my effort into becoming a hospital administrator. Of course, when I graduated from my master's, a couple of things I've done in my life is I was always going to go to a larger facility, larger town, Fort Worth, Dallas, Austin, go to a big city, because growing up in Clifton, I never was going to come back here after I graduated. And so slowly after graduating my master's, getting married, the rural healthcare just really kind of hit me and realized how great it was growing up in Clifton. And never is 13 years. That's how long it took me to get back to Clifton. And ultimately, having quality care locally is very important, so that when people are doing, when my dad or when we're out, residents of our county are sitting here working on their houses, they can, or snake bites or anything in our rural area, that quality of care is so important here. And I just feel like it's better care when you are comfortable in your hometown. And so all those nevers turned into what I'm doing right now.
So it's interesting. You were drawn back into rural care. And my next question is going to be interesting about what you found when you came back versus where you are today. But I think one of the important things for people to understand, and I think we forget this, first of all, 97% of the United States land mass is rural. Mm-hmm. We always talk about the big institutions, and that is the focus typically of healthcare. But actually, the majority of healthcare starts in our community. And whether you're in a big city, that is your community, or in a tiny rural town, that's your community. Mm-hmm. Healthcare is really a local phenomenon. And they always say all politics is local. Well, I promise you all healthcare is local. Mm-hmm. And so it starts with that. And in the rural environment poses really substantial challenges that you don't have in the big cities necessarily that you talked about. They're different. And we're going to talk about those. But so you came back, your 9-year anniversary. You come back into the institution. Were there any surprises when you got there about what you didn't expect when you showed up at the doorstep here at the hospital? What was the reception that you got of coming back? And how big are the changes that you've seen over the last 9 years in your institution and maybe in healthcare delivery itself for you?
So ultimately, I wasn't really shocked on the things that I saw. Most rural hospitals, including this one, we struggled financially. We worked very hard on perception to make sure that people can trust the care they get here. So coming here, it wasn't very, very shocking ultimately. The reception was really great. I did have a couple teachers say, "Man, Adam, this is not what I expected when you were in my class." I still don't know if that was a compliment or they were really that shocked. But ultimately too, coming back, being in a financially strapped organization, a lot of times when we bring in the equipment to become best practices, a lot of times it's refurbished or older models. And sometimes that's not what your staff want to see, is that we should not be the hand-me-down little brother that gets everything handed down. And so ultimately, we started looking at where we're at and where we're going to go, and hopefully where do we fit in the system of healthcare? Because as much as we talk about rural and urban, it's a team sport to me. I have to have the urban because we don't do everything, and we have great relationships with our tertiary hospitals because when they come in our ER and they exceed our capabilities, we're going to do what we do great, which is stabilize them if they're having that heart attack or stroke, and then get them out to that tertiary care so that they can go to the specialist and the cath labs and be ready. And so those are kind of the things that I saw and where we're going that kind of make me understand my place in rural healthcare, which is, we have to be better than we've ever been. And even after the last 18 months, that's really been the message. But we just got to do what we do and do it great. And time is always of the essence.
So we're going to get back to that concept of time because it's an important one. But the other thing I want to get to that's in this conversation is, as you look at, and these are important, is that I always think of the letter P. And when you look at a new institution, and I came to a hospital that wanted to grow, it was the people, the processes that we had in place, and the products, i.e. equipment. And as we worked on all of those three things led to the perception of the institution, if you will, within that community. And of those things, which did you address, or all of them? And how much of a role did products play in the perception of the hospital within the community?
Well, I think we've touched all of that for the perception. Ultimately, you start with the people. You got to make sure that the culture that we have here is the culture that we needed to be moving to the future. And of course, a lot of your culture is driven by people. And so we worked really hard on the people. That's even more truer today, moving through COVID. And so the people were very much a priority. Products were not as the highest priority, but we did start chipping away. Ultimately, we got a brand new EMR right after we got a new EMR. So probably did the wrong thing within that first 6 months of being here, signing a new contract for a brand new EMR. That's what we consider one of the bigger name brands in the industry, which is Cerner. And so that kind of gave that real big boost to the people by buying a great product. And so the people and the product, or the equipment aspects, were very important for our perception. Processes, we have great processes. We also have staff that wear multiple hats. And so some of our processes weren't as efficient as we needed to be. And so we're always constantly looking at that for efficiencies. Just work smarter, not harder. That's our whole goal. So I don't think there's anyone in our industry that's only focused on one of those three P's, in my opinion.
Yeah, and so as you look at those, they obviously are very interrelated. And this conversation, as we talk about Butterfly and what role it's playing in all of this, obviously it's an important addition and change and transformative around the country and around the world, actually. So it's going to be very interesting to see how it's played into that. As you looked at those three, the last one, as you think about your organization, do you see a new level of pride in your institution now, 9 years later, than you did at the beginning?
I think so. I mean, I can't imagine where we were. It's hard for me to imagine where we were 9 years ago and where we're at today. A lot of that has been just always trying to change our mindset from being reactive to proactive. And by doing that, that brings that pride that we're ahead of the game. I kind of go back, COVID's been such a part of our life over the last 18 months to 2 years. And even just us implementing things for COVID and thinking, how can we best, take care of our organization as well as our county and our citizens and patients. And so that pride of, man, we've done this, we can do this, it's no big deal. So that pride has really increased a lot. And again, you focus on people and you give them reasons to believe and trust this processes and change, because that's all we've done is pretty much changed over the last 9 years. And so it does, when you look back, that's when you start swelling with pride and just realize, man, we came so far, but we're never done. That's the one thing we got to realize is you cannot just sit back and say, okay, we're here, because our industry and our world never stops. And so neither can we.
So it's interesting, your approach to this, which I really admire. Tackling Cerner within an institution of your size, that's a little snake looking at a big meal going, but it leads to your thinking and thinking big. Tell us how you moved toward finding Butterfly. How did that happen for you? And what was driving your thinking about saying this innovative technology should come here, maybe before it's come to a lot of other places around you?
I was fortunate to kind of see Butterfly at one of our state conferences for the Texas Organization of Rural Community Hospitals, also known as Torch. And Butterfly had a booth there. And, as a CEO, just kind of walking around, seeing what new products were out there, Butterfly kind of just struck my eye. It's the cool factor. I mean, here is a ultrasound wand that can plug into my phone, and I can start scanning. In fact, they let you play with it. Well, a CEO playing with that, it was fun. And I was just blown away by, wow, this is awesome. There's that cool factor. So of course we kind of brought it in. And really, when we looked at that product, we were thinking, we still deliver babies in our rural facility. So we still have, we utilize family practice with obstetrics physicians, and we we were sitting there thinking, man, going through the time when I had children, every time you go into your monthly follow-up, you want to hear the heart rate, you want to see your growing child, and so here's this handheld that you can take into the room, and we could do it every time. So I really kind of looked at it when we were looking at it, the cool factor, but also the patient perception of the care they're getting. They can now see their baby every time they walk in because every one of my FPOBs have a butterfly. However, it didn't stop there, because once you give it into the actual hands of people that know what they're doing, not just me, they have everyone wanted it, whether it was my internist to my family practice, or the FPOBs. And so all of a sudden they all want one, and they're using it in different capacities in their clinic, or we get to put it in our ER, which again, there's times you need ultrasounds, and instead of having them play bumper cars with the large ultrasound that we've had with the walls, they can just plug it in their phone, go in the room, and start scanning, and it's right there for the patient too to see it. And so what started as just this wow cool factor of, man, this is a pretty cool tool, we could utilize this for patient satisfaction with our OB patients, has now blossomed into every physician using it for different capacities. The funniest story is when I went back to my board to justify buying, we just wanted to get 5, one for each of my FPOBs and one for the ER. And so we started talking about it, showing them the product. And I've never had it, but my board just looked at me and was like, are you sure 5's enough? Maybe we should just go ahead and buy some more. And it's true, we did. So we just kept adding to it to give every physician one. And it's also come in handy with the new changes that we put in place for COVID patients, why we're trying to segregate them and keep everybody well. My physicians can take out this butterfly out into or to the patient that's our COVID patient wing, and they can still do scans and everything, and it's just much easier, more effective, and it's handheld. It's just small. You take it anywhere. As we look to increase our OB satellite clinics in our area to try to get out, this is so easy for them to just take, and it's not huge. It fits in a little briefcase, and it can go anywhere. So that's kind of how we started. It's just some things to me just look, man, that's awesome. I don't know what I'm going to do with it, but you give it to the hands of the right people, and there's no stopping them.
It's interesting. You bring to the table, and I think a practicality and just a basic, and I say this with the most West Texas logic. It just makes sense. It just makes sense. And I think many people start in that capacity to look at this. And I think what's interesting, and you mentioned earlier the importance of time. If you think about the way in which we deliver healthcare, if you don't know what's wrong with the patient with a simple history and physical examination, 2/3 to 3/4 of the time, it's simple imaging that answers that question. The problem, and no matter what the facility, whether you're in a rural facility that you may or may not have the resources, either in-house or the equipment, or a major academic institution in which there are limited resources and lots of patients, time is of the essence, and you wait. How much of a role has this played for you within that environment?
We haven't had to use it in that capacity. We are implementing it fully right now, but to have it in the ER and they just plug it into their phone or into an iPad, walk into the room, and they can get their image. We're not waiting for my ultrasound techs to finish something on our actual ultrasound capabilities. It's also, the patient can see it right there. So there's just this need that we can use it, and it's right there, it's handy. And again, there's still a little wow factor, so you find yourself wanting to use it more often in those ER capabilities. So we can transfer people out or whatever we need to do. So it's actually, talking with my physicians, they're excited because there's so many capabilities right there. We don't have to wait. You don't have to move the patient. You're not transferring the patient from your ER to your radiology department, which they're right beside each other, but you're still having to transfer them, and it's all about patient comfort too, and not just timing, but you're not transferring the patient more than you need to. If they find something that needs a higher level of ultrasound, of course we'll get them there, but you're not going back and forth multiple times trying to wait on them to finish a study or transferring them out. The docs have it right there and start working, and you're talking about a matter of minutes versus 10 to 15, 20 minutes.
Yeah, and those minutes, actually, when you're a patient lying in bed wondering what's wrong with you, or you're a physician having anxiety that you don't know what the diagnosis is, those minutes matter. And what's interesting is that doesn't matter whether you're rural or urban. That same thing's there. Now, a lot of urban emergency rooms have lots of cart-based systems, but physicians go through this mental thing of, is it worth going to find the cart? Should I go get the cart to bring it in here? Where when it's in your pocket, you make that instant decision. Well, I'll just pull it out of my pocket. It's the same way I use a stethoscope. I just listen. Well, now I can look. One of my favorite sayings now is, and I'm being self-deprecating, well, I can listen and guess, or I can look and know. And that's
Right.
the difference, really, that this has made. And it sounds like your physicians have embraced that. Let me ask this other question. You said the physicians were excited, and wow. I think we've all felt across the country, and COVID has added to that. Medicine stopped being fun for a lot of people because of, candidly, the EHR that you brought on board. And I can speak personally. It's not a lot of fun. I didn't get into medicine to put stuff into a computer.
Right.
But if I wanted to be that, I'd have been a computer programmer. I wanted to be next to patients. I don't want a computer between me and my patients. And so I think I found that to get in the way. What I've seen with Butterfly, and you seem to be expressing it, it's brought me back to the patient, doing the things that I actually wanted to do. And that connection with the patient seems to be real. It seems as if your docs have experienced that at your institution and added a newfound enthusiasm for their practice.
I think so. I mean, it's a small toy almost like looking thing, but it's so powerful. It's actually a tool. And so anytime you can give your employees, your physician, your nurses, anybody a better tool to do their job or make their job easier because you gave them that tool they needed, it does make it look, number one, it makes it look like, hey, Adam really does care about our work environment. But number two, it's just right there. Like you said, it's another tool to do their job and to do it well, which is what they all want to do, is do the best job they can. And we always say, do the best job you can with what you have. Well, now we have a better tool. And so they're getting to do it better. I was talking to one of the physicians the other day who was utilizing the Butterfly to do a knee injection in his clinic, something we do all the time. They don't always use a ultrasound guided because they don't have it right there. It does take a while, but here it is. And he said, Adam, it was so much different, and how much easier it was to do my job, because here's the Butterfly, I'm doing the ultrasound, and I can now put that needle right where I want it and take out, like you said, some of that guesswork that they've done forever, and they know exactly where they want it, but now it's not just where they want it, but they have the confirmation it was there. And so it makes them feel good. I've found that our nurses have started using it in some other capacities. And, again, right now, our job with how healthcare has gone over with COVID and how that really has sucked out a lot of our fun too, is all of the waves and being inundated by so much. Staff are exhausted. So what can you do to try to make it look a little bit better, or maybe just a little bit more enjoyable? And they get to play with this Butterfly in a training, and then they get to take it back and be in front of that patient who's like, what are you doing? What is this? And, they get to talk about how cool it is. And of course, the patients, I have yet to hear anybody think that this isn't the coolest thing they've seen. And so again, it's about that patient confidence, because, I've been a patient. I can't tell if my nurses are giving me my flu shot correctly or not. Why does it hurt this much? Well, maybe there's reasons to that because of me, but no one else is complaining about the flu shot hurting right now. They have a different form when it comes to my shot compared to maybe, other patients, I guess. But
well, you're the CEO. They bring out a much bigger needle for you.
I swear they do. And they just use this little jabbing motion on me. I've never seen it.
It get to be this instead
Yeah.
of this.
Well, it's funny when it comes to our shots. I've always offered to give flu vaccines, and no one has ever allowed me. I can't even pay them to let me do it. So they're a lot smarter than I give them credit at times.
Well, it's interesting. You talk about this and you use the word, and I know our engineers are probably rolling over and shuddering when you use the word toy. But it actually, Leonardo da Vinci may have said it best, and that is that simplicity is the ultimate form of sophistication. And part of the beauty of Butterfly is we've made the device simple to use. And the software that we put into it is building artificial intelligence tools to make it simple to capture images and to interpret images. And that simplicity fuels adoption. It fuels consistency. And so the other thing that we've noticed that you've also mentioned is it decreases the anxiety of patients. Because when all of a sudden there's a device that's right there in front of them and they see the images, they're not as scared. Every patient, and I can say this from a physician's perspective all the time, when an ultrasound or stuff's being done, they're not looking at the screen, they're looking at the eyes of the examiner to see if they can read for that. Well, now they can see both. See, here it is, this looks great, and that changes the way care is actually being delivered.
Right. And the patients, it is a calming. And again, that's why we kind of started this, was to have a patient satisfaction tool to increase the satisfaction. Because again, as a new mom, or even as one that's going through their pregnancy again for the fourth time, it doesn't matter, but everything they want to do is see their baby and hear that heartbeat. And now they get to do it. We can do it every time they walk in, and it doesn't take any time at all. And it just gives that confidence and that euphoria that that's my baby and it's growing. And so that's why it started, and it just kind of ballooned into all of these other areas once we implemented it and kind of rolled it out. You bought it for a select few, but you couldn't tell the other guys who were jumping on board, the family practice that are not delivering, you couldn't tell them no. They weren't going to stand for it. So that's kind of why we, luckily my board told me, hey, you should buy more. Let's go ahead and take care of this now in one purchase. And so, yeah, the patients have really gravitated when they got to see it. And even if it is asking, hey, what is that? And the doc taking just a few extra minutes to show them just some of the capabilities. So they leave knowing that we are committed to best practices and being progressive when it comes to healthcare, and whether we're in a rural town or not. So it's been wonderful.
How much has price played a role in what you've been able to do with this? Has that been a big factor in actually being able to roll this out? So
price is always a factor. However, we have kind of figured out over the lifetime, it's not going to be that big. Because ultimately more patient confidence and better perception will ultimately increase your volumes down the road. And as my physicians are learning to use it, we have the capabilities of taking those images and billing for them that we may have not been doing in the past. And so ultimately, I don't think that the price point was anywhere different than buying your new Apple phone. So it always plays a part, but it wasn't so much that I felt like it was a risk. Again, it was truly at a price point that we were willing to do it for patient satisfaction, not just for the billables and any type of revenue that could come from it.
And as you looked at this, I guess this new model, which, as we're talking about the hospital of the future and tools of the future, this model of every physician having one seems to be working well for you. And would you say that that's where this world is going, that this is going to be the new stethoscope?
I'm not going to say no, and I'm not going to say yes. I can see where tools like this will be where we're going to go. Again, it's doing our job better, more efficient, smarter. Patients don't want to be here one more minute, like you said, whether they're being discharged or whatever. And so, yes, having it right on you or having it so nearby that you're shaving minutes off of a visit, it's absolutely necessary. And again, our job is to make sure that physicians have the tools they need to do their job. And our physicians do a great job here. We may not have the latest, greatest, equipment and items that are out there at any given time, but we always try to find what can we do and where can we go. And Butterfly just really fit a good niche of where we're going is more, right here, right now. I mean, the whole world is, we don't have patience when it comes to our everyday. We want everything now. And so here's a tool to give them what they need now. And it just makes everybody's life a little bit easier.
One of the interesting transitions we've made in realization as a company and this has been an important one for me as a physician, we focus on the tool because that's the tangible thing I can put in my hand and I think of what I buy and what I deploy. What's really happening is I now have the ability to get information. Mm-hmm. And it's actually that information that the tool provides that's really changing the game for me. And now I have information sooner. And it's an interesting part of our message. And what happens is that it's almost flowing beneath the surface without a realization that all of a sudden I have access to information that makes good clinical decision faster. Actually making that a more prominent part of the discussion we've seen has had people stop and think, well, yeah, actually that makes sense. It's really, why do I do a test? To get the information. Why do I need this tool? To have the information. And I think it's pretty hard to think in any situation in clinical medicine where better information faster doesn't lead to better medicine, lower cost, better outcomes, better patient satisfaction. And I think that's part of what you've described really in the transformation of your institution with this device. You've brought this onto an institution, places that didn't have that. How difficult was it for adoption for physicians? Was it a protracted period of time where they had to learn, or do you think they picked this up pretty quickly?
I think we see that with, for the most part, everybody picked it up as quickly as they're able. That it's hard to say anytime when you're implementing anything who can pick it up. Some people will gravitate to it quicker, and some may have more training. But Butterfly's training has been really spot on. They've done a lot of one-on-ones with each physician and been with them in front of that patient as they've done it. So I think implementation for the most part, I would say, has been very speedy. If you look at the timeline of implementation, the actual implementation has been a few weeks to maybe a month. But unfortunately, we picked this up right before this last wave of COVID hit. And so we've had to, we couldn't do the implementation. We couldn't get a team from Butterfly here. And my doctors were seeing 40, 50 patients a day because of the COVID and everything. And so implementation, don't look at my timeline, look at when we actually started it, which started, a few weeks ago on our phone calls to full implementations, only a few months. And some doctors really picked it up quickly. And those are the ones that really were excited about using it. The other ones that may not have the most excitement have been able to pick it up as quickly as they want. And I think that's kind of like, I look at it how I adopted myself to picking up the apps in my phone versus my dad. He's doing as much as he wants with what he's got, and he could do a lot more, but he just doesn't have any ability. He doesn't have any need to. So I don't push on, hey, you need to download these apps and do that. And so, but like I said, it started with a few select physicians were in our mind, but it did not take long for the entire group to come to me and everybody want one.
We're notorious as physicians, even if we're not the most adventuresome, we follow the same bell curve that the rest of society does. But when we start seeing other people practice better medicine, happier patients, faster throughput, and their patients walking out with a smile much faster than the rest, or, I think we're very quick to look over our shoulders at the other person's test and say, get me on this. I want one of these too. Looks like that's been a reality for you at your institution.
Yeah, I don't know. I think so. I can't tell you how it all works, but when your patient comes out and they're like, man, that's cool, and then they go and tell their friends, is what you want, that word of mouth marketing. Hey, yeah, I went there, and they busted out an ultrasound and plugged it into his iPhone, and we were looking at my my joints and I was getting a shot. Well, then that person may go to their physician, hey, can I see this butterfly? And so, yeah, you don't want to be the one that says, well, I don't like to use it, or I'm not using it. And so
I'm going to pick up my rotary phone and I'm going to call somebody. And that doesn't go over big. And, you know, I think part of the excitement of Butterfly, and we've seen it in a lot of different places, because now that it's up on the space station, you know, they're using it up there. And now that it's been on, you know, the Inspiration 4 flight and in professional sports franchises, you know, you can start to share with patients. They like that. That's cool. They use the same thing on me that they're testing up on that space station. That's pretty cool. And that changes the perception of the institution. It's a real credit to your leadership, to the institution of where you're taking it. So as you look at this and the technology it plays, how does it evolve into the bottom line for you? And is that kind of the new focus of how is it going to impact your bottom line from a financial perspective? Because at the end of the day, the lifeblood of a rural institution is how can we be profitable? Does it help by more efficiency, better referrals, keeping people there? I know you're early in that journey, but is that going to be a focus of yours going forward?
That's always a focus, as you said, but I do feel like Butterfly will bring, again, a better perception. We're always working to have a better perception in our communities. And I don't care what size hospital, we're always working on that. And so I do think the perception, but the efficiencies, physicians being able to do more with less, or see the same amount, see more people with the same amount of time that they were, because they're no longer waiting for that information they need to diagnose. You know, they can take it in, do it right then, and they can then get that patient on their way versus waiting that 20 minutes, have the patient, you know, walk to radiology, get the study done, wait for it to be read or, you know, transmitted to them through our PAC system. Here, it's right there. And so I can only see where when these things come in, you're turning over patients quicker, or at least getting information quicker so you can get them on their treatment, or that referral faster. As we have specialists that come in, you know, we might be able to walk them right over to them that day and say, hey, can you see this guy, versus waiting another week for the specialist to come back. And so I think there's a lot of optimism that it's going to drive a lot of good things. In the end, the only negativity that you could really find from this is that maybe down the road it just starts collecting dust, but it's not looking that way right now, when, like you said, physicians are putting it in their coat pocket, or it's right there on their nurse's station in their clinic, where they're walking by it constantly. So it is right there, just like any other tool that they're using. You know, a thermometer to take a temp, you know, it's right there with them. And so I can't see where it's not going to have a positive influence to our bottom line.
Yeah, and it's interesting as we look now that with medical schools across the country adopting, you know, using this technology as part of their fundamental education from the beginning, you know, all medical students coming into class at a number of schools now, many schools. I think the physicians of the future, and I admit this of myself, they're going to be better doctors than I was, because I just know how powerful this information is going to be. How have you seen this leak over into the community itself? So you're responsible for the hospital. What's your role out into the community, and do you see this impacting home care and things like that in your environment, as well as you say you have somebody in a nursing facility or a rehab facility? How do you see this playing a role there?
So ultimately, I failed to kind of mention, you know, Goodall-Witcher is a 25-bed critical access hospital. We operate 2 rural health clinics, home health, nursing home, and a fitness center. Part of rural healthcare and our RHC, our rural health clinic, is our physicians are the ones in the clinic. They're also, many of them are working in our ER through shifts there. They're still rounding on their patients on the floor. They have their panel of nursing home patients. And so, and ultimately too, we're in an area that OB services are actually shrinking, not expanding. And so we're looking at how do we put up satellite OB clinics. And so this product allows us to do everything. You know, we can take it with them. So when they're going to a nursing home, they're having it right there. It's not bulky. We've had other small ultrasound devices that we just had to get that cost way more than a butterfly one. And it's just too bulky. And they've complained, it's bigger than a briefcase. So why would I want to take it anywhere to a satellite clinic or to the nursing home? This just fits in a backpack and they go. So we are seeing a couple of the docs take it to the nursing home. And so if there was just something that's just questionable, again, they're doing that firsthand review before transferring them out of the nursing home into our facility to get the study done. Now they're having a little bit better way of doing it at home, or doing some of these ultrasounds at our satellite clinic versus, again, a much bigger, bulky, more costly system going that more than likely will break anyway. Because again, for some reason, they've always found ways to make bumper carts out of anything on a cart, whether it's our computers on wheels or an ultrasound. So it is going to spill over. It's still fairly new. I've just had a few friends or a few people out in the community when I'm at the grocery store saying, hey, we had that new tool y'all have that, and I was like, the butterfly, and they're like, yes, and one of them called it the moth. I give you just got butterfly is kind of a unique name at times, but we're starting to hear people kind of talk about it, and that's not customary. Most people don't code to the hospital or the clinic, and then when they see me, it's usually a complaint. Sometimes it's a compliment, but you really never heard, man, Adam, those needles you bought are stellar, And so for them to actually understand and see, that means the doctor is taking time to kind of explain this new piece of equipment or tool. I'll quit using the word toy, but this new tool to their patients. And so that you're kind of seeing that. And it just kind of makes you chuckle because, again, that's kind of what we want, is that perception of, man, we're ahead of the game. And that's what our goal is. Our goal is to quit being reactive and be more proactive. And I think rural healthcare has to be proactive because we already have our backs to the corner due to a lot of the other hardships, lack of volume at times, which create a lack of a bottom line. And, one mistake can, Aunt Susie will tell all of the people at the hairdresser. So I feel like we have to be very progressive and get out in front of these things before we're just kind of slowly adopting.
It's interesting, the analogy I often use, and maybe not a great one, but you think about it, and we've got the playoffs going on in baseball. The small market teams just have to be better. They have to have a better farm system. They have to have a better process because they don't have the money to spend. It's not that different in rural healthcare. You have the same objective: take great care of patients and do the things we do. In a baseball team, it's win the games. You have to be better at it because you just can't throw money at the problem. And it's interesting, as you look now, well, the other thing, COVID has been a big equalizer in those major institutions because they really got hurt. They didn't have the surgical procedures and the volume of revenue that was generated from all that stuff because COVID took it away. They have to be better. And listen, you only have to be a patient in a major urban city emergency room once to know it's got to get better. And I think part of the whole mindset of Butterfly, why this company was created, was understanding the power of information, of the information that medical images provided at a timely, more efficient manner, just changes the game. And that availability of that information creates incredible disparity around the world. It creates disparity between an urban, well-funded hospital and a rural institution. It creates disparity between the United States and Africa, as an example. And the goal of Butterfly is a great equalizer. What I love about your story is, and about you personally, is you get it. You understand the value that it delivers. You are the very essence and the embodiment of what Butterfly was made for. What's a little bit interesting for me is I bet the teachers in your class probably didn't look at you and say, wow, I see Adam. He's going to be that great innovator going forward. He's going to be the guy plowing the new fields. How have you seen yourself? Where did that transition come from you, from being that guy that really wants to plow forward and being on the front end of the spear? Because that's not everybody.
I think a lot of it's just driven that I am the CEO of the hospital where my family still works and or still lives. And so coming back, and all of my friends that I graduated with high school or knew, my goal is to make sure that when they come into this hospital, they're getting the highest quality care, and frankly, better care than anywhere else, because there are neighbors, there are patients, or not just our patients, there are neighbors, our family, our friends. And so some of that is, that's what drives a lot of that, to try to be innovative and push the envelope. I think the other part of that is we got to be better, because financially I can't just keep doing the same thing and stay open. We got to keep pushing the envelope. And then I think some of it's just my youthfulness. Again, some of this butterfly started because I thought it looked cool. I mean, the CEO has no business touching, an ultrasound wand of any sort. But I'm sitting there and they actually let me look at my carotid arteries, and there's that cool factor that I was like, man, even I like it. Let's see what we can do. Because again, it's that you talked about the 3 Ps. We wanted to give some product and a piece of equipment to our staff that's kind of unique, cool, not out there and everywhere, to give our people better, but make them feel more excited. And then that just kind of spills over in your processes. And next thing you know, it is your perception that we're the one out there trying to do what we can to get better every day. I tell a lot of people that we're not perfect, because the difference between being perfect and striving for perfection is perfect, you've done everything right, there's no way to improve. Perfection is we still will make mistakes, we still hit road bumps, but we're going to learn from it and correct that issue to find the next one. And so we always strive for perfection because we're not perfect. And the better we can be at delivering care, quicker care, getting that patient to the higher tertiary hospital quicker to save their life. I mean, COVID has taught us that we can do it. We've had too many patients that needed to go to that ICU that we could not get out, and we then have to take care of an ICU level patient because there's nowhere else to go with COVID. We can do it. Now let's start putting a few more tools behind us to make it more habit and not just out of need, because there's no other way of transferring the patient. And so yeah, COVID has taught us that we have to do a lot more. And there's a lot going to be expected from us, and we're okay with that. We'll take that task, and we've done excellent at doing that. But we definitely need to make sure we can get what tools we need in order to make that happen, and give that confidence to the staff that are being asked to do more than what they're accustomed to.
Yeah, and I think that is such an important point, because if you think about, and I'll speak again as personally, but I know my colleagues are the same. We sit into a comfort zone of practicing medicine in the way we're comfortable. That's because it gives us great confidence. We feel this sense of liability. We have some predictability as we think of what's going to happen in the future. Liability's out there. It's not as big a role as everybody thinks. I think it is for most of us practicing medicine. It's just we want to have confidence in the decisions because we care about the outcome of our patients. Stretching past that's hard for us. It's really hard. And so we need a little bit of that safetyness of saying it's okay to push ourselves. And I think what Butterfly does is it's cool, it's simple, and the value proposition comes so quickly that all of a sudden you feel a little bit more comfortable. And then you enter in COVID that pushed us a little harder. It pushed us farther out there to say, and then what we learned was actually we can do this. And I think the secret of what you've learned there, and the secret we've discovered with others, is that keep pushing. There's a safety net. You got a big ultrasound machine, you got a CT scan or whatever, you can get those, but push what you can do with this device, because seeing is knowing, and the power of information to make clinical decisions in so many different situations. There's a whole lot of situations we don't even think about getting an ultrasound where we should. And we're all of a sudden, holy smokes, what does that do for me? And I think that's really where we're going with this. And I really admire you for taking us on that journey. I hope you're having influence in others around the state and others around the country. It's really important that the lessons that you share today, because what you're talking about and everything you say is really modern healthcare. It is the hospital of the future. The hospital of the future of modern healthcare is not static. It's dynamic. It's willing to move. And candidly, what's really cool is when the product's cool and looks good, it feels modern. It feels like the future. And when you can see the future in your hand, you're more willing to go there. It gives you confidence. And then that confidence you have in your community moves things forward. And so I'm really impressed with what you've been able to do there. I congratulate you. You are the embodiment of the envision of Butterfly. And you know, I think you should certainly have a butterfly tattoo. We got to change your license plate. But we're very happy to partner with you, and we're excited that you took this journey. And certainly I'm very grateful for the lessons that you shared today. They're heartfelt, they're genuine, and they're real. And I think that really matters. And I thank you for taking the time to speak with me today.
You're welcome. I've enjoyed it. I could talk all day long, as you know.
Yeah, I think you make it easy, and candidly, you make it easy to listen, which is great. And we look forward to, as the pandemic comes down, to meet in person, to continue this journey, because you've started down that pathway. There's a whole world of potential that we're still develop and explore together as Butterfly evolves, and the new technologies that we bring, the new software that we create, the new educational tools to accelerate adoption, and hopefully to identify with you the value that it actually creates, so that we can see more efficient care, more cost-effective care, where healthcare wins, patients wins, and the system wins. But thank you very much. I've enjoyed this very, very much.
You're welcome.
Thank you, John and Adam, for sharing your stories and great achievements. And thank you to our session sponsor, Butterfly Network. You can learn more about Butterfly Network by visiting butterflynetwork.com. Thank you.